This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. This is Steve Love along with Thomas Miller. We know it's been a long week, a tough week, and we know the COVID-19 virus has spread through North Texas. We're going to unpack that, discuss it, and we're just going to see where we are and where we're going to be headed over the course of the next few weeks.
Yeah, and Steve, you know, the virus got really personal for our little production team this week, didn't it?
Yeah, it really did. I can certainly attest to that, Thomas, and you may want to share with us what you shared with me.
Well, I had a friend in Denver who was actually from Vail, but he was in a hospital in Denver for the coronavirus, and he passed away since we have been together on this show last.
And we're so sorry to hear that, Thomas. We certainly offer our condolences to you.
Well, thank you, Steve. Make no bones about it. It has been tough and so bizarrely unexpected. He went from healthy to ventilated in about 72 hours. So if we please listen to what we're talking about here, because this is, I mean, if you think you're in your 30s or 40s or otherwise good health, so was this guy. He lived in the mountains and lived the mountain lifestyle. So it can, you say, what is the profile of somebody who gets the coronavirus? It looks like you and it looks like me. And that's the message that we'd like to communicate. Steve, you were very involved in the conversations and the meetings and the modeling of what became county-wide shutdowns here in North Texas. Can you go back and talk about what you communicated with those teams and especially with the governor's office last week?
Yeah, Thomas, you know, there have been a lot of models out there. For example, Neil Ferguson has done a lot of modeling. He's out of the Imperial University, which is in London. There's also models tying into that COVID Act Now. There's the Penn model. There are many different types of models. And, you know, there are variables that come into play. You have to look at infection rates. You have to look at the age of the individual. You have to look at estimated hospitalizations. I've seen percentages from 5 and 6% up to 20%. My point is there are a lot of moving parts. There are a lot of variables. In looking at many of those models and actually extrapolating some of the CDC numbers and overlaying them for Texas and North Texas, we realized, even though our hospitals were prepared, and we've said all along we're prepared, if those models that were predicting the future were correct, we were going to have a big increase in volume to the point that it could actually be what we call surge, where you would have a surge. So with that, the hospital council, not in any way trying to frighten anyone, not to panic anyone, we raised our hand and said, regardless of which model you look at, there's going to be increased volume. So yes, I contacted the governor's office, frankly, last Saturday, about 8 days ago, and said, we really need to take a good, hard, serious look at what we can do to do a stay-at-home statewide. We also asked for some other things like waiving some of the clinical rotations for nursing students so we could get more in the workforce. And the governor did do that, and we thank him so much for doing that. But as you know, he left it up to each individual county or city or municipality to make their own decisions. And while many have responded, and we certainly thank them for that on the stay at home, there are different types and inconsistencies, and we were just hoping to have it statewide. So we've been doing a lot with modeling. We've been doing a lot looking at volume. And at the same time, we have, I would say, began to look at surge if it comes. And many people say, well, what a hospital is going to do with surge? I like to categorize it generally into 3 stages. Stage 1, all hospitals do their own internal surge planning. And let me elaborate on that just a little bit. That's where, when clinically appropriate, they may put two patients in one room that previously were private. It may be that they can go to clinics, outpatient areas, and temporarily put beds there where they can expand their capacity. There are things they can do on their campus or within property they own to really expand to handle increased volume. And that helps a lot. That's stage one. Stage two, that I like to call, is where you work with counties and cities to look at vacant buildings or buildings maybe that used to be hospitals that you could quickly get the oxygen lines turned back on and get everything up and running within a short period of time so you could at least house patients temporarily. Why do we need the cities and the counties and their emergency management? They need to waive permits. We don't need to be worried about, I need a permit to do this, I need a permit to do that. They can cut through that red tape. Many times they can also access funding that will help in an emergency to take care of that. And then we move to what I call stage three. Stage three is where you may have to bring in FEMA. You may have to bring in the Department of Defense. You can take a mobile hospital in many cases and put it up inside another structure. By that, I mean you could do it inside of a convention center, and you could actually construct a portable hospital that could house maybe 250 people inside a convention center. So there are many avenues that are open to you. We coordinate. We work with the emergency management people at both the city and the state level. But each city's different. What you do in Dallas may be a little different than Fort Worth or Plano or Denton. So that's why we all have to work collaboratively together to handle emergency planning.
So we are seeing how this might look in places like New York and Los Angeles and San Francisco and now New Orleans, getting really close to home. If this works, will we be ahead of the game compared to maybe some other cities that were earlier and got caught more flat-footed on this?
Well, we certainly hope so. I think the fact that we really are looking at Seattle, where unfortunately it entered through the senior living and the skilled nursing facility. In New York, you have more density. So there are variables in each location. Even if you go to Italy, epidemiologists mentioned to me there are multi-generations living in the same structure, the grandparents in many cases, and the parents, and then the grandchildren. So there are little tweaks in different areas and regions. We hope the actions we've taken are going to help us flatten this curve. If you flatten the curve and you flatten the infection rates, that's the key to keeping this from being completely surged to a point that you have real crisis.
Steve, let's continue this conversation in the next segment because there is so much more that we would like to hear from you on. We will continue our conversation on the human side of healthcare with Stephen Love, the CEO of the DFW Hospital Council, on the shut-ins in North Texas, right after this quick break.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And we're back on the human side of healthcare talking about the shut-ins, the big story of this week with Stephen Love, the CEO and president of the Dallas-Fort Worth Hospital Council. Stephen, can you give us a peek behind the curtain when you called the governor's office last weekend and you gave him some of the possibilities? What did that look like as far as how many beds we have and how much demand could exceed that?
Well, each model's different. We look at the available beds. What's really important is available beds. You look at licensed beds, which is the total beds the state licensed you for, but then you're going to have patients that are in there. So let's say you are licensed for 100 beds and you've got 80 patients already in those beds, then you only have 20 beds available to receive new patients. So what's important, we work regionally through our North Central Texas Trauma Regional Area Council. We call it the RAC, where they bookkeep, for lack of a better term, the number of beds and the available beds so we can look through the region. So we look at that, and then we look at the models, and then we kind of say, okay, even though each model gives you a little different answer, it is showing an increase. We want to make sure that we have enough available beds. And we might. I'm not saying we're definitely going to run out of beds, but it's going to be pretty close. And that's why we wanted to flatten the curve. And that's why, we wanted a statewide stay at home, because we thought if we could flatten the curve, there would be three things that would come out of that. One, it would certainly reduce, we hoped, the infection rate. That's number one. Number two, it's going to save lives. If you reduce that infection rate, you're going to save lives. And number three, it's going to not only protect the residents of Texas, but our healthcare heroes. And I'm talking about the first responders and our healthcare workers in the hospitals. These people are on the front line. They absolutely are doing a heroic job of helping protect the health of our community.
Let's draw this in to the what's in it for me kind of perspective, because everybody's being asked to sacrifice. And I think everybody's okay right now. As it gets warmer and as this drags on for however long it drags on, it might be that we start to wonder what's in it for me. Now, I mentioned at the beginning of the show that I lost a friend to the coronavirus this past week. He was 64. He, to my knowledge, had no other underlying conditions. So this could affect any of us. We're hearing stories now. One out of San Francisco of a child under the age of 18 died from this. Millennials are being affected by this very much. And the thing that I'm seeing, Steve, is that people are not taking this seriously. So how do we make this shut-in work?
That's a good question, and it's difficult to answer. It's kind of like, why don't people get their flu shots? Same type of principle. Again, I'm not a clinician, as you know, but when I talk to the infectious disease physicians within our health system, so when I talk to the county health departments, they say this is very serious. Generally speaking, as you said, the older adults and people with underlying health problems are impacted, but they're seeing this impact everyone. And the other thing you've got to realize, even if you're younger and it doesn't impact you personally, you could be a carrier and you could infect people that are much more vulnerable. I don't know. I think we have to impress on people this is serious. We're all in this together. We're going to have to collaborate, but we also are going to have to take personal responsibility. And that personal responsibility is, I'm going to do my part. I'm going to practice good health habits. I am going to stay at home, and I'm going to do everything I can to comply with what our county judges and our mayors and our public officials have requested. I think regardless of how the counties do it or the cities, I know that the mayors and the county judges truly care about the health of their community. And I heard County Judge Glenn Whitley on TV the other day, and he kind of hit it on the head. I mean, he nailed it. He said, folks, just use a little common sense. Use a little common sense. So, Thomas, that's good advice. Maybe each of us needs to use a little common sense and do our part.
I saw this week the mayor of Chicago had to reach out with a very stern message to the residents of Chicago on this note because they weren't taking it seriously. I've seen other parts of the country where people are out exercising and they're stacked on top of each other, or after their exercise, they're having a gather around the car and play music and this kind of thing. Now, one of the advantages that we have here in the Dallas-Fort Worth area and in North Texas is it's going to start warming up. We're already there. This week was kind of the turning point. Do you think that will work to our advantage?
I have no idea, and I'm not giving you a flippant or short answer. I've talked to many of the infectious disease docs, and I've talked to public health officials. They don't know. In fact, I actually heard one public health official say they were looking in other parts of the world, in other continents, where they were fearful that this might recur next year, kind of like the flu. And so we need to develop a vaccine. Maybe you end up getting a flu shot and you get a shot for COVID-19. So, Thomas, I really don't know. When I talk to the scientists and the real experts, until they can really get the evidence, they're not going to say. So, whether warming up's going to impact it or not, I don't know.
Okay, that's a really good answer and a really good point. To drive home, is there is so much unknown about this, and that's why we're asking people to do what you're asking them to do, is to stay on the safe side of this. Let me ask you something on the stimulus that was passed this week. Now, you have a financial background, CFO. We had a $2 trillion stimulus package, and one of the elements in that is $117 billion for hospitals. How will that trickle down to North Texas?
Well, obviously it's going to go through some waivers. Some will go to the state and some will be disseminated in different ways. But I think there's a couple of things we need to learn from a stimulus bill. First, I applaud the government for trying to do everything they can to stimulate the economy. It's certainly the right thing to do. Secondly, I think it's very important that we realize that many independent local business owners are really hurting. And when you think in terms of the public health and doing the right thing for public health, that's certainly what you want to do. You want to improve and keep the health of the community whole. But there are many restaurant owners, local owners of small business that our hearts go out to. I talked about the healthcare heroes, and they certainly are the first responders and the people that work in hospitals. But trust me, hospitals are sympathetic to these local business owners that are really making a big financial sacrifice. So I hope the stimulus that comes down is going to benefit all the people that really need it. I know there'll be some people that say, hey, here's what's good about the stimulus bill, here's what's bad. But, I think we have to kind of stand together and say the intent overall was to help stimulate the economy and to help people that really are having a very hard financial impact.
Do you have any idea on how long we might be at this?
No, I've asked some of the experts, and again, I'm not a clinician. The best answer I've been given when I've asked some of the epidemiologists and when I've asked some of the people that deal with infectious disease, if they kind of look at China, if they kind of look at what has gone on in Italy, that it could easily be 2.5 to 3 months. But each region is different. Each society handles it differently. Different types of prevention and flattening the curve are in. So it's hard to predict. I've heard no one really go out on a limb and say it's going to be exactly this time or not. So I think we're just going to have to let it play out. Right now, as you know, the number of cases, unfortunately, in North Texas continue to increase. And Thomas, we're going to all work together. We will get through this. It's tough now, but it is going to get better.
Well, thank you, Steve, not only for the work that you've been doing, tireless hours and very short nights, but also the calm, confident, and wise leadership during these unprecedented times. I'd like to tell you of a few other resources. If you'd like to email us, write radio@dfwhc.org. Also, all of our episodes and often unaired extension interviews are available on all the major podcast sites. Just search The Human Side of Healthcare. Now, let's turn our sights to a very positive side of healthcare and introduce you to a new facility in North Frisco that's likely to be a model for the future. As the DFW Metroplex expands out, hospitals are strategically positioning themselves to meet the needs of these suburban populations. And the new Texas Health Frisco is a brilliant co-affiliation between Texas Health Resources and UT Southwestern Medical Center and School. We will meet the CEO of this dynamic new facility, Brett Lee, when we come back on The Human Side of Healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you The Human Side of Healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back to the Human Side of Healthcare. Steve Love along with Thomas Miller. As you know, the demographics continue to change, and we have population growth here in North Texas. So we thought a great topic would be, as you build or start a new hospital and you incorporate into that things that the surrounding demographic areas of the consumer really want, why not bring in someone who has just done this? We're delighted. We've got Brett Lee. He's the president of Texas Health Frisco. And Brett used to serve on my board here at the DFW Hospital Council. So this is going to be a fantastic interview. Brett, thanks for being with us.
Thanks so much, Steve. Thanks for having me.
You know, as you think in terms, and many of our listeners hopefully can visualize this, a hospital in the future, from your perspective, Brett, what would that look like to you? And how do you think we are really shifting our focus when we design or in the design phase of building a new hospital?
Yeah, great question, Steve. And I think there are probably two macro trends that are influencing the design of hospitals these days. The first is a shift of patients from the inpatient setting to outpatient settings. There are patients that would have only been seen in hospitals 4 or 5 years ago that are now only seen in ambulatory settings. And so when most people think about urban hospitals in particular, they're large facilities that are located in downtown urban centers. I think that high dollar fixed infrastructure is going to get less and less over time as the demand for inpatient care gets less and less. So there's always going to be a role for hospitals within the care continuum, but I think it's going to alter going forward, and we have to alter the design of our hospitals to keep up with that. And I think the other macro element that's affecting hospital planning is urban sprawl. So here in Dallas-Fort Worth, for instance, most of the growth is happening in the suburban areas. And so it's outside of the downtown area. It's moving out toward the north and to the east and to the south. And so where we just built our hospital is an hour and a half away from the downtown center. And so as each of these suburban areas go through their own evolutionary process, they reach a point where they say, we really want high quality care close to home. And so rather than building a hospital in a downtown setting and expecting people to travel for care, folks in these suburban areas want high quality care, the same access to the high quality care you would get in large centers downtown, but in a much more convenient setting. And so when we went about building the hospital that we just completed in Frisco, we created it in a collaboration between a large academic medical center and a large community hospital operator to hopefully blend the best of what you would expect with an academic partner, the breadth and depth of service, high quality experts, but blend that into a community hospital setting that's nearby where the population growth is happening.
You know, when you mentioned, as I was listening to your answer, how you blended in that academic expertise and then you brought in the aspect of a community hospital, you also are in Frisco. Right. So you have residents, you have consumers. How did the residents of Frisco, one, influence the structure, and two, some of the programs and services that you offer?
Absolutely. So historically, and this is the fourth hospital I've had a chance to build, historically, hospital operators would just do some market study in a new market, come in and build a facility, and basically then try to convince the folks who are in that community that we brought them exactly what they needed. And we decided to take a very different approach. Healthcare is focused and is becoming more so focused on a very educated consumer base, and consumerism is driving a lot of decisions in healthcare right now as folks are demanding a different level of transparency. And so from the very beginning of the design of this hospital, we sat down with focus groups from the community, community leaders, but also people who lived within the community that we were going to be serving to get their feedback about what was important to them in a healthcare campus. And many of the themes that came out of those focus groups influenced the design of this hospital. So we heard clearly that Frisco was very interested in environmental issues, and they wanted an environmentally friendly campus. Healthcare campuses by design are typically campuses that use a lot of resources, and so we wanted to make sure we minimize that as best as we could. So we incorporated a reclaimed rainwater system when we thought about our irrigation. We used native plants from Texas to try to reduce the amount of water consumption. We used building methodology with substances on the exterior of our building that absorbed heat to try to reduce the amount of electricity that we would have to use to heat and cool the building. And so we also heard from Frisco very clearly that it is a community that supports local businesses. And so when we were planning our food service offerings, for instance, we incorporated local businesses to help us plan and implement our coffee bar on campus. We heard very clearly that it is a health conscious campus or community. And so as we were planning our campus, we incorporated walking trails on campus. We have yoga classes and boot camps to make sure that we're promoting health and well-being and not just acute care. And then when you look at the demographics of Frisco, the average age of the community is 36. It's a very young community. So as we were planning the services that we provide on campus, it's very much catering toward that demographic. So women's service is a big offering for us. We have orthopedics and neurosciences and things that would cater to that population, but then we can evolve those services over time as the demographics continue to shift.
You know, you mentioned the direct consumer. Many people, our listeners, may not realize it, but we'll remind them that in many towns and communities, hospitals are large employers. Right. They inject a lot back into the economy. So they're an integral part of the economic structure. So even though you get good input from the direct consumer, did you solicit input from business and industry and their expectations in Frisco?
Oh, absolutely. And we were very fortunate to already have strong relationships with the business community up in Frisco that had been cultivated over several years. But we really accelerated that process as we began the planning for the hospital. And so everything from sitting down with the Chamber of Commerce and leaders on that group, which I now serve on the board of the Frisco Chamber of Commerce, to going out and discussing with large employers what their unique needs were, what wasn't being met, and similarly with small employers and partnerships in the community, what role did they want to see us play in terms of maintaining the well-being for their employee base. And we've invited several employers to come and tour the hospital even before it opened so that they could have an insight into what the campus had developed based on their feedback. And so we see our role as caring for the entire community, and that includes the employer base as well as the general community.
With the input from the direct consumer and business and industry, as you look in your crystal ball, what are some other things new or improved services on the horizon?
Yeah, I think it goes back to the concept of not dictating what we think the care delivery experience should be, but really listening to our consumer and then modifying our care delivery platform to meet their needs where it's important to them. And so as we think about how we've designed this hospital, it leverages resources within the broader network of both UT Southwestern and Texas Health to provide telemedicine consults, to provide access to home visits through our Dispatch Health partnership, to going out and providing care and wellness education within the walls of those employers, within the walls of our school system, partnering more broadly with local not-for-profits to improve the well-being of the patients that we serve, and then also leveraging technology to bring resources to the hospital that may have been more difficult to obtain as a standalone community hospital. So providing teleneurology consults, having access to specialties that wouldn't be typical in a medium-sized community hospital to provide better care, more comprehensive care to our patients and families. So it's all about not being so hospital-centric, but thinking more globally about the entire patient experience and leveraging technology effectively to help us with that.
You know, you mentioned the average age 36 in Frisco, and man, I just kind of got depressed over here because I've been in healthcare a long time, but I have seen how so many things have changed. What do you see now is the role of hospitals and health systems in changing to meet the needs of the community?
Yeah, great question. I think that historically, hospitals have worried primarily about what happens within the walls of our facilities, right? So we plan programs, we focus on providing high quality care when folks are sick enough to need to be in the walls of a hospital. And that's still an incredibly important piece of what healthcare systems are going to do. But more and more, we're held accountable for what happens outside of our walls. And a patient may be within the walls of a hospital for a very short period of time. But if we think differently about how we partner with that patient, with that neighbor, then we can partner with them for a lifetime of well-being. And so what we've thought about as we built this Frisco hospital is redefining our role of what it means to provide care within the community of Frisco. So not only are we focused on leveraging the strength of our partnership with UT Southwestern and the breadth and depth of expertise that exists at Texas Health to provide outstanding care in the hospital setting, but we have worked upstream with our physician partners in the community to make sure that we have access to outstanding primary care. We are working with the community in local not-for-profits such as Frisco Family Services that services families that are in need. And we're partnering with them to provide nutritional education, cooking classes, so that families can make better choices with limited funds to make sure that they're providing healthy choices for their families and not just what's easy and convenient. And so,
Brett, let me jump in here just real quick, if you don't mind, because that clock on our wall is going against us right at the moment. Would you hold over for the next segment?
Oh, sure. Would be happy to. Thanks.
All right. We're going to be talking to Brett Lee more about demographic expansion in the Metroplex. Remember, you can catch this entire interview on our podcast, along with all the others on all the major podcast players. And the Human Side of Healthcare with Steve Love, Thomas Miller, and Brett Lee will be back right after this on 1080 KRLD and radio.com.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And we're back continuing our discussion with Brett Lee, who's president of Texas Health Frisco. Brett, in the last segment, you discussed about the role of the health system in the community. Part of that, and we know in healthcare that patient satisfaction, family satisfaction, consumer satisfaction is an important part of delivering good health care. With Texas Health Frisco, did you do hospitality research, kind of like Ritz-Carlton?
We did, and it's funny that you mentioned Ritz-Carlton because that's actually the group that we brought in to help us with this. And it goes back to a very personal story of mine. I took my wife and son to New York City a couple of years ago for spring break. He wanted to see The Lion King on Broadway, and we happened to stay at a Ritz hotel. And we were leaving to go see the play, and we mentioned to our housekeeper in passing that we were going to go see The Lion King, and my son was very excited. When we came back to the hotel, on his bed, there was the soundtrack for The Lion King and a stuffed lion that was waiting for him. And so that made an incredibly personal impression on us, and it created a tremendous amount of brand loyalty. And it took that housekeeper paying attention to the little things that we were talking about, understanding what personally was important to us, but then taking the initiative to make sure that we had a unique experience at that hotel. And so the wonderful thing about creating a new hospital is you get to ask, what if, right? What if we created an environment that had that same personal touch in terms of every interaction? And oftentimes we in healthcare, and I'm a recovering clinician myself, we're told to create some professional distance between ourselves and our patients. And I think we do have to be professional, but I do think it's really important that we get to know them personally and that we understand what's important to them. What are their goals in terms of their interactions with? And it's not just to get healthy again, but it's why do you want to get healthy again? What are the things that are really important to you personally? And so that's why we brought in the Ritz-Carlton to help us with learning a daily focus on creating unique experiences for our patients and families, empowering our staff to make a difference in real time instead of doing service recovery. How do we think about creating a unique experience on the front end as our folks are interacting with us? And we're reinforcing the concept that we are neighbors caring for neighbors. We just happen to have a different skill set, and we hope that everyone who comes into our hospital feels like they're coming into our home.
Brett, Thomas Miller here. I'd like to spin a little yarn with you here, if you don't mind.
Sure, absolutely.
This whole thing fascinates me because obviously one of the areas that I think we all could acknowledge at this table is that healthcare is one of the slower adopters of consumerism, and it's kind of been stuck in its ways and technology and everything else. So I'm thrilled to hear this. Everything that you're saying is just yes. So one of the things is when you mentioned the shift from inpatient to outpatient, how did that show up in the design of the building?
Sure. So as we received the feedback around what services were important to the community and how we started to craft our clinical portfolio, the needs really drove the design of the hospital. And so rather than building a large campus with 300, 400 beds to meet this growing community's needs, we really crafted the footprint of the hospital to meet the immediate needs of the community, and then put in enough space to expand with the community, both in size and complexity over the next couple of decades. So we started the hospital with 73 beds so that it can be comprehensive and provide outstanding care, but be nimble enough to be very customer focused and easy to navigate. So the exact opposite of going down and trying to navigate parking in a large urban setting, but really focused on creating a warm and welcoming community hospital feel. And then we have multiple shell floors that can be built over time, and we have 20 acres to grow into over the next couple of decades. So we do see ourselves evolving into the medical district for those far northern suburbs. It's the area is growing at 1,000 people a month, so the need will be there. But we wanted to make sure we're growing thoughtfully and not creating an experience that wasn't akin to the community hospital feel that we wanted. The medical office building, one of the wonderful aspects of the partnership with UT Southwestern is this is the first time in this amount of specialties that they've brought their expertise, their multidisciplinary approach to care off of their main campus and into a growing community in this type of setting. And so the medical office building is largely all faculty, but we did create a space on the 4th floor of the medical office building so that we could incorporate some community physicians as well. And because there are certain service lines that are well represented up in Frisco from community physicians, we really wanted this to be a melting pot of a campus. And so when you look at our medical staff, it's about half UT Southwestern faculty and half community physicians. So our intent is not to be exclusive to the academic partnership, but to create service lines that hopefully integrate the very best expertise that exists up in that community to provide outstanding care to our patients and families.
Wow, that's exciting. All right, here's another peek behind the curtain that I can't wait. So when you got those suggestions in that partnership with Ritz-Carlton, take us into one of your staff meetings when you're incorporating. What did you fold into your operations from that?
Absolutely. So the two things that are foundational elements of our culture, that's the other wonderful thing about building a hospital from the ground up, is you get to start to lay the framework for your culture from day one. We wanted to put outstanding clinical outcomes and an outstanding consumer experience on equal footing in terms of how we value those. So if there is a failure in customer service, it is attacked with the same ferocity and structure as a wrong site surgery. And so every morning we start with a safety huddle where all of our leaders around the organization walk through any leading indicators that could be safety concerns. So staffing issues, any unusual things going on in the hospital. And then we look forward 24 hours to say, is there anything coming that we need to be mindful of as a leadership team? And then we go out and round, we call it our Gemba walks. We round through every department of the hospital every morning. And each of the hospital departments have their own unique key performance indicators that they're working on to improve in multiple areas relative to our strategic plan. We then get direct feedback every day from frontline staff about how we can help them do their job better in terms of providing outstanding care. But also in that safety huddle, we talk about our customer service credo that was developed in partnership with Ritz-Carlton. We talk about what opportunities that we've identified to create unique customer experiences with the patients that we're serving today. We've armed them with tools and resources to be able to make those differences in real time. And then when people do, we bring them into the huddle so that they can be recognized in front of all of their peers. And so it's critically important that it's reinforced, this commitment to service is reinforced on a daily basis, and everyone carries their credo card with them to all of those huddles. And so it's something that we think about every moment of every day.
In your role in a community such as Frisco, and for many of our listeners, especially if you're listening outside of the Metroplex, we refer to the Metroplex here in North Texas, Frisco is a very, very growing community. He's already told you the average age is 36. So a lot of the consumer needs are much different than would be, say, in a traditional downtown setting. Has this been difficult in dealing with clinicians? It's one thing for your staff, but as you have clinicians and other allied health professionals, how have they joined this culture?
Yeah, it's something that you have to make a priority from day one. And one of the, again, I keep going back to the fact that we're a startup and a greenfield project. It allows you to be really thoughtful around how you select people who share the same vision of what we're trying to create in Frisco. So with everyone that came through from an interview process, either from a leadership perspective or a frontline staff perspective, we used a behavioral interviewing set of tools that allowed us to select people who were not only very technically competent at what they do, but were comfortable being in a rapidly changing environment, because as a new hospital, we're going to look very different a year from now than we do today. We'll continue to evolve in terms of complexity and size and scope. But then we also wanted to select people who had a heart for service, that really wanted to understand and incorporate these unique customer service aspects that we were putting in place, and that wanted to be in Frisco, had an affinity for the community. And so when you look at our staff, 2/3 of them live in the community, including the physician staff. So many of the faculty that came up from UT Southwestern also live and now work in our community. So they have a passion for providing care. They understand the demographics that we're serving. And I think that translates into the type of care we're able to provide.
There is so much more that we talked with Brett Lee about this dynamic new facility that's available on our podcast, The Human Side of Healthcare, on all the major podcast players. We'll be back next week with all the latest updates from Steve Love's perspective on where we are in North Texas on the COVID-19 fight, and more from the DFW Hospital Council. Thanks for listening, and stay safe.